Hello, we are from the Acute Care Occupational Therapy team at Mount Sinai Hospital. This video is in preparation for your upcoming shoulder replacement surgery.
In this video, we will cover your post-operative shoulder restrictions, how you will properly wear, take off, and put on your sling, and how you will carry out your daily activities upon discharge. After surgery, there will be important restrictions to maintain in order to allow proper healing of your new shoulder. The first is no bearing weight into your surgical arm. Your sling will reinforce this. However, be careful not to weight into your surgical arm when lifting off of a surface to stand or when moving out of bed. The second restriction is no active motion at the shoulder. This can look like lifting your arm overhead, raising it to the side, or even just slightly hiking your shoulder up, forward, or back while in your sling. You will be expected to wear a sling that will be provided to you after your surgery. The sling will be worn at all times except for when changing clothes, washing up, or performing exercises that will be provided by your hospital therapist. The sling should be positioned with a 90-degree bend at your elbow across the stomach. The next section of this video will go over how you will take off and put on your sling, both with assistance and independently. This will also be a reference for you following your surgery. Now we're going to be going over how to take off and put on the sling if you have someone who's available to assist. Looking at the sling, we have two Velcro straps and a buckle. First, the person helping you is going to remove the Velcro strap and then the other. It's very important that you make sure there's no active movement at your shoulder while the person is helping you. The third step is to unbuckle the clip and to make sure to support the elbow at the same time so that the arm doesn't flop. Now for putting the sling back on, again, you're gonna make sure that you're not moving the shoulder at all and that the sling is placed all the way back so that the elbow is to the back. And you can make sure to feel the elbow in the crease. Just like we unbuckled the Velcro strap to start, we're gonna replace it. Same with the second one. And then the person helping you is going to take the buckle and snap it in. Now we're going to be going over how to take off and put on your sling independently. First, you will need a waist height stable table in front of you. Next, you're going to start by removing the first Velcro strap and then the second. You're going to bend your knees and lower to the stable surface without putting weight through your arm. You will then unbuckle and bring the strap over your head using your non-surgical arm. To place the sling back on, you'll have the strap on the table and the sling sitting open. Again, you'll bend from your knees without any active motion at the shoulder and without bearing weight into the table. You're going to bend your knees and make sure that your arm and elbow get into the corner of the sling, like so. The same way that we took the sling off, you're going to first Velcro the first strap, then the one with the buckle, and using your non-surgical arm, you're going to place the strap over your shoulder and buckle. Dressing and undressing your upper body is going to be an exception to wearing your sling. We recommend wearing loose-fitting front button shirts. When dressing your upper body, you're first going to dress your surgical arm without moving the shoulder as we discussed previously. Using your non-surgical arm, you're going to thread the shirt while remaining relaxed over the surgical arm until you reach the neck. Then you're going to take your non-surgical side and place it through the other sleeve. At this point, without moving the shoulder, you'll be able to use your hands to button the front of the shirt. When removing the shirt, you'll do the opposite. First, you'll remove your non-surgical side, like so, and then use that to unthread the surgical side. In terms of using the bathroom, if you will be having surgery on your dominant arm, we recommend practicing both cleaning yourself and lifting and lowering your pants with your non-dominant side in preparation for the surgery. If surgery is on your non-dominant arm, it's still a good idea to practice performing these tasks one-handed before your surgery. In terms of sleep, if you do not have a recliner chair to sleep in, we recommend that you practice sleeping on your back or on your non-surgical side, as it will be very important that you don't roll onto your surgical side as to break your weight-bearing restriction. When exiting bed, it is best to exit towards your non-surgical side, again to avoid bearing weight into the surgical arm. Finally, your occupational therapist is going to meet you at the bedside to go over these topics in more detail and to answer any questions that you have.